So in today's class, we will be discussing about the management of physically challenged children. Okay. So who is a challenged child? So challenged children are those may be presented with the difficulties, either physical, mental, or social. And these difficulties are maybe in the form of any kind of impairment or any disability, or it may be a handicap. So these children are known as challenged children. So today we are going to detailedly study about how we can manage a physically challenged child. So let's see the types of handicaps. Under physical handicaps or physically challenged children, they may be blind children, deaf, dumb, and crippled children. And mental handicap means mentally retarded children and child with CP and other associated problems. And socially handicapped children are those like orphans, neglected or abused children, then children of divorced parents or step parents, and delinquents. Okay. And now we'll see how we can manage the physically challenged child. So, physically challenged children want to be normal as possible. So, hence, the nurse need to find out the child's strength, and these children need to be successful throughout their life. So, they may be born with a certain kind of physical disabilities. The same time, the nurse can find out what the strength such children may be having. Then keep the expectations from the child within his own limit, that what he can achieve. Only that much expectations we can give for those children. Don't assume or don't try to get what you are assuming from that child. Then do not allow other children to pass any rude comments or tease the handicapped children. So that is usually happening in the schools and all. The normal children usually they will tease or they will pass certain rude comments upon these physically handicapped children. So that need to be avoided. Then make adjustments and accommodation whenever possible and make the child to participate in all the activities. For such reason, the nurse or the teacher can do certain accommodations or adjustment in the activities so that these children can actively participate in the activities. So that will provide them a kind of successful like a reassurance to them. Okay, and never pity these children because they really don't need it, because they have born with certain kind of physical handicaps but they may have the strength to overcome that. So never feel pity or don't say any pity upon these children. Then, child with the irreparable defect should be taught to face the world and live openly with his handicap. So that is the most common thing the nurses has to do. We have to reassure him and we make them to live with their own handicaps. Okay. Then the child should be reassured about the positive aspects of disability. So every time when the nurse is educating the client, teach the child regarding that he may be having a positive defect and he has to be live with that one. Okay, then provide maximum learning opportunities to these children. So usually if the child is born with any kind of these kind of handicaps, they may be having certain difficulties to cope up with the situation and to face the world also. In such situation, appropriate educational opportunities needed to be provided to them. Okay, that is one thing to be considered. Then make the child feel that he is loved by everyone and he is supported by all. Then what care we can give during the time of pregnancy in order to avoid such kind of physical impairments. Okay, so during the time of pregnancy, during the 9 months, avoid any kind of hard physical work such as carrying any heavy load, especially in the field, or any other accident prone activities like walking upon the slippery ground, then climbing up of the stairs, climbing up of the chair, ladder, etc. The mother has to be avoided. So any kind of injury happening during the pregnancy time can lead to the physical damage to the fetus. The next one, avoid unnecessary drugs and medications. So that is also one important factor. So other than the prescribed medications from the gynecologist like iron, calcium, folic acid, like thyroxine or any other tablets, no other medications and antibiotics are not allowed during the pregnancy time. These can cause serious damage to the fetus. Then avoid smoking, chewing tobacco, consuming alcohol and narcotics. So all these things like smoke, tobacco, they may contain cancer producing substances or other chemicals which can damage the fetus. Then avoid X-rays and exposure to any kind of radiation. That is also an important factor. Then avoid exposure to illness like measles, mumps, etc., especially during the first trimester. So the first trimester is the time where most of the baby organs are getting formed. So in such situation, any exposure to X-rays or any infectious disease conditions like measles, mumps, etc., can cause serious damage to the fetus. So that things to be avoided. Then take precautions against lead poisoning. So lead is a very harmful chemical for the fetus. So the almost all exposure against the lead has to be avoided. Then eat a well balanced and nourished diet supplemented with green leafy vegetables, proteins and vitamins for the proper growth and development of the fetus. Then all women of the childbearing age need to consume zero point 0.4 mg of folic acid daily. So this usually the folic acid is daily prescribed in order to avoid the neural tube defects. So neural tube defects are the most common reason for the development of certain neurological impairments in the child. So in order to avoid that, all children during their childbearing age to be supplied with a zero point 0.4 mg of folic acid daily, and these folic acids are nowadays available. They are combined with the iron also, so this will helps to prevent the anemia during the last trimester of the pregnancy. So anemia can also cause certain kind of physical changes in the baby as well as the mother. Okay, then during the pregnancy time, the average weight gain should be 10 kg, and the mother has to gain 10 kg during the 3 trimesters, and she has to undergo the regular medical checkup also. So all these things will help to avoid the development of physical impairments during the time of pregnancy. The next one is regarding care at the time of birth. So, what are the things to be cared during the time of birth? So, delivery must be conducted by the trained personnel, preferably in the hospitals where all facilities are available. So, here in most of the remote areas and all, they are promoting the home deliveries. So, during the home delivery, there are chances of what death for the child or any kind of injury or any kind of infection, etc. All these can cause to certain kinds of infections for the child and damage to the child. So this to be avoided, and all the deliveries to be conducted by the trained personnel, and especially in the hospitals. And if the baby does not cry immediately after birth, the resuscitation measures has to be taken in order to make the child to cry. So that is for the independent lung development of the child and for the making the child independent. Then the babies, those who are born prematurely, like before 30 weeks or before 28 weeks with a low baby birth weight, like less than 2.5 kg, they need the intensive care in the NICU. That is also one of the important factor. So, in order to make the growth to achieve completely, the child has to be cared in the intensive care unit. Then sometimes some babies are born with a enlarged head or small head. So in such cases like any hydrocephalus, macrosomia or microsomia, in such situations, a consultation has to be sent to the pediatrician for the correction of these problems and identification of the exact cause. That is also important. Then, what are the care we can give during the early childhood time? So that is also an important era where the almost all the growth and development of the child usually take place. So, what are the childhood care we can provide? So, do not allow the child's temperature to rise above 101 degree. Why? Because if there is a rise in the body temperature, it will increase the brain metabolism, and this will be leading to febrile seizures. And once the febrile seizures is developed, there are chances of the neurological impairments to develop. So, in order to avoid that, never allow the child's temperature to rise above 101 degree Fahrenheit. Immediate hospitalization is very important. Then, every child should be immunized against all the infectious diseases as per the recommended immunization schedule. So, never miss any kind of vaccinations, and if you miss the vaccination, go and take the vaccination immediately, because these can protect your child from meningitis, pneumonia, such infectious diseases. Okay, then do not allow the child to have too much contact with the paint, then newsprint ink, lead, etc., because they may cause toxicity, and lead also a severe toxic substance which can alter the growth and development of the child, which can also cause certain kind of physical impairments also. Then take precautions against head injury and other accidents. So early childhood is the area where most of the accidents usually take place, like a fall, then head injury, etc. So all these has a negative impact upon the growth and development of the child. Hence, all the precautions to be taken to prevent the head injuries. Then ensure that the child is getting a well balanced diet and clean drinking water for the appropriate growth and development of the child. Then introduce additional foods of good quality and in sufficient quantity when the child is 4 to 6 months old. So up to 6 months, it is recommended that the child should receive only the breast milk, but 4th month onwards, the weaning can be initiated. So when the mother is starting with weaning, she makes sure that the child is receiving good quality, protein-rich diet in sufficient quantity as well as the quality for the growth and development of the body. Then vitamin A deficiency and its consequences to be monitored, and all children should be given with the appropriate amount of vitamin A supplements in order to avoid blindness. So blindness is a major cause for physical disability among the child. So vitamin A supplementation is necessary. So the mother has to focus upon that. Then protect the child from meningitis and encephalitis by providing hygienic environment like free from overcrowding, etc. So as I already said you, the neurological disease conditions like meningitis and encephalitis, which can cause serious nerve damages and may lead the child to a neuropatient. So in order to avoid that, meningitis and encephalitis prevention measures are to be taken and the child to be taken appropriate immunizations on time. Then common salt must be iodized as a precaution against goiter and cretinism. So goiter and cretinism may lead to a delayed growth development in the child. So this has to be prevented by the supply of common salt. So all are the major measures we can provide to the child in order to prevent the development of physical impairment. Then, apart from that, once the child is grown, do not allow the child to use certain kinds of hairpins, then matchsticks, pencils, etc., to insert into their ears. This is a common thing we usually see in every house. So here they will insert the hairpin, matchstick, etc. into the ear in order to remove the wax, which can cause damage to the tympanic membrane. And once the tympanic membrane is broken, the child can develop into a hearing loss. So that has to be monitored. Then use ear protectors to reduce the exposure of high levels of noise if the parents are living in a noisy environment. That is also to protect the child from hearing loss. Then do not slap the child over his face, and this may lead to injury to the eardrum and consequent hearing loss. So all children must be protected from all kinds of assaults, injury, etc. Otherwise, there are chances of damage to the eardrum and hearing loss, etc. So these all are the measures what we can do during the early childhood care for the prevention and management of physically handicapped children. Okay.